Hey fam, in the first vlog I ever made, I asked you to pause the video and get a drink of water, and I'm just deciding to bring that back. So pause the video, go get yourself a drink of nice cold water. This is the introduction video to a little series that I'm starting, and I'm gonna call it Hella Health. In this video series, I plan to tell you about the health promotion field and also give you advice and information about how to be healthy. Starting with hydration. Hydration is very important. At my college, this is free. You go to the coffee shop, ask for a cup with ice, and you go to the drinking fountain, fill it up. This is free. Free hydration. Money tip, hydration tip. Episode 1 is going to be about what is health promotion. My major is health promotion, and I am taking a course that is called Health Promotion and Education. The book that we use, which I'm going to read from, is called Principles and Foundations of Health Promotion and Education, 6th edition. The definition in the textbook says that the Joint Committee on Health Education and Promotion Terminology, which is an organization that is responsible for reviewing and updating the terminology of this profession, defines health promotion as any planned combination of educational, political, environmental, regulatory, or organizational mechanisms that support actions and conditions of living conducive to the health of individuals, groups, and communities. I chose this major because I care about others a lot, and helping others is one of my passions. And originally I wanted to be a nurse, but then I learned that you can't avoid needles if you're a nurse, and I have a very bad phobia of needles, so I decided to go for the broader field of health promotion. Okay, but what is health? When they say health promotion, we are promoting health. What is health? The World Health Organization, WHO, has defined health as the state of complete mental, physical, and social well-being, not merely the absence of disease or infirmity. This definition can be found in the Constitution of the World Health Organization, which also includes more statements about health, like health is a human right and a whole bunch of other stuff. It is important to note that health is multidimensional, not just your physical health, your emotional well-being, your spiritual health, your social health, your health in the workplace. All of these things matter in the definition of what health is, not just your physical health. Mr. J.J. Hanlon, in his 1974 book about public health, said that health is a functional state which makes possible the achievement of other goals and activities. So health is a state in which we have well-being in all the dimensions in our life, and we can better work to achieve our goals to the best of our ability, the best that we can. And health promotion is all about positively impacting a person's behaviors and their living conditions to improve their quality of life and make them have a better life and live longer. Their job is all about studying a certain population or community at the state level, at the city level, at the county level, at the country level, at the global level. So it's all different types of sizes of population that they study. And they look at this population and see what health concerns are there, what diseases are popping up, what health concerns do we see, what patterns do we see that are a problem, and figuring out what can we do to combat these problems. So these are the health departments at small levels, bigger levels. A great model that we learned is a basic model for what the health promotion people do, and it goes: assess needs, set goals and objectives, develop intervention, implement that intervention, evaluate the results, and repeat. Those in health promotion gather information through epidemiology, which is the study of the distribution of health-related states or events, including disease, and the application of the study to the control of diseases and other health problems. That definition comes from WHO 2013. And they gather this information through so many different methods, like surveys that are conducted by the government at the local level, at the bigger levels, looking at certain populations, looking at certain things. There's a whole group of people out there in the government whose job is to gather epidemiological data. Then they try to spot certain diseases or health concerns in that population and try to figure out a way to combat it. They design interventions or programs or policy that can help people work towards better health. They can do this by influencing government policy or community policy or educating the community. Education is huge in this field. What else is huge in this field is prevention, which the United States healthcare system doesn't really emphasize. We are very big on treating of illnesses and injuries and diseases after they've happened, so what we would really like to see is more prevention. So the health promotion people use data and psychology to figure out and design which approach would be best in making the most effective change that they want to see. I could go into more detail about the types of information they gather and all of these things like that, but this is just an intro, and that's basically what the health promotion field does. They look at communities and try to figure out ways to positively influence behavior and living conditions to help people be healthier. There are several jobs that work on each task in this whole process, so it's a very broad field. So if you're in this field, you have a lot of choices. And that concludes the introduction episode to this series. Thank you for watching. I hope you learned something. I hope you're all staying happy, healthy, and hydrated. Feel free to check out my music channel. I'm a musician as well, so if you want to see me making music, you can go check that out. Thank you so much for watching. Bye.